Does a hospitalist have a medical degree? Yes, a hospitalist does have an advanced medical degree. Many times people ask how to become a hospitalist physician, and the answer is actually quite complex. Becoming a hospitalist is a very difficult endeavor that requires discipline and many years of education, training, and certification. The first initial step in becoming a hospitalist doctor is getting accepted into medical school. Although not all medical schools require a formal degree, they do require completion of prerequisite courses prior to application. In addition to the required classes, medical applicants must also shadow physicians, volunteer, hold leadership positions, and perform well on the medical college admission test, MCAT, board examination. Each of these steps must be completed by a very rigid published date to align with certification necessary for application to a school of medicine. If you are interested in attending medical school to become a hospitalist physician, please research content for admission very carefully. During medical school, one must pass for board examinations in general medicine on a different published date for each exam as determined by their medical school. After completion of 4 years of medical school and certification of a MD or DO degree, one is a doctor but cannot yet practice. Individuals must then secure a spot in a residency, which is usually done at a teaching hospital. Residencies provide clinical hands-on training in a specific field like internal medicine and prepare individuals for a board certification. Most hospitalist doctors complete a 3-year residency to internal medicine and are termed internists. Near the end of residency, individuals must pass the internal med board examination by a certain published date determined by their residency. The practice of hospital medicine may greatly overlap with internal medicine, but hospitalists are not always an internal med doctor. It is important to note, however, that individuals that receive board certification in other residencies like family medicine or that are fellowship trained, and specialty trained physicians with careers in intensive care medicine, pulmonology or nephrology may also practice hospital medicine. Upon completion of residency and board exams, individuals are fully trained hospitalists and may secure a job in hospital medicine. In some larger cities where there may be a pediatric hospital, hospitalists that have received training via a pediatrics residency can be found and are commonly called pediatric hospitalists.